farmer first visited the village, it was one of the poorest places on earth and had some of the worst health statistics out there. Despite growing up in relative poverty, he was appalled by what he witnessed. Peasant farmers were living in huts made of straws and brick. There was little to no access to drinking water or food, and there was no medical care of any kind. So after going back to the States for medical school, he wrote in a publication detailing about the poverty he witnessed. A man named Tom White read this publication, and what he wanted to see came for himself. He traveled with farmer to Haiti, and he too was appalled by the poverty he witnessed. He donated enough money to fully fund the first hospital in Miles. Zombies Lante were also known as Partners in Health in Creole. This was a big impact for this area, and millions of peasant farmers relied on Zombies Lante. Now, long before Zombies Lante was built, and long after, Hall Farmer practiced a sort of medical care that I like to call a hands-on approach. He would travel miles on end to see his patients, bringing them water, food, glasses, toilet paper from the States, really anything they needed. He didn't only assess their medical needs, but also their personal ones. Many people called him St. Farmer, and I'm inclined to agree with that title. Now, one time while he was back in the States, a woman died of tuberculosis. This was a disease that Zombies Lante believed they had eradicated in the area. So when he went back to Haiti, he asked the medical staff, "Why did this woman die of a disease we had eradicated?" Well, they said to him, "She wouldn't have if you were here, farmer." Well, to me, that's quite a guilt trip. But what they meant by that was that he was providing a sort of social care that was gone when he wasn't there. That without him, this care was gone and people were dying. So he made a study to test this theory. In this study, there was two groups of tuberculosis patients. In group 1, they only received TB medications, while in group 2, not only did they receive TB medications, but also additional services, such as small monthly stipends for food, child care, and transportation. Now the differences in the results of these two groups were vast. In group 1, only 43% of the patients were cured, while in group 2, 100% of the patients were cured. Tracy Kidder, author of Mountains Beyond Mountains, writes that 12 years later, since Zombies Lante has implemented the TB program of including additional monthly services, not a single patient has died under the care of Zombies Lante from TB. Hall Farmer is a human embodiment of what I'm trying to convince you of today. That if we want to create a healthier tomorrow and a healthier America, we cannot do it within the traditional healthcare paradigm. We have to have a new system. A system where healthcare and social care work hand in hand, entwined in everything we do. Oftentimes when we think of healthcare, we think of chemistry, biology, genetics, but we forget this other key component, social care. We have to remember that healthcare doesn't begin at the doctor's office or the hospital, but rather in our community. We need to reframe, rethink, not to be too on the nose, unlearn how we see healthcare. We need to start viewing healthcare as a social science. Okay, I'm going to pause you from jumping to some conclusions. Because if you're over 40 and you happen to be my mom, you may be thinking that I'm trying to make a political statement. But I believe that if you stick with me and have an open mind to what I'm saying, you'll realize that this matter is not one of politics, but rather of humanity. I'm not sure if Farmer knew this when he made the TB program, but what he was addressing was called the social determinants of health. The social determinants of health are 5 social factors that affect the health of both an individual and a community. They include education, economic stability, social context, your built environment, and your healthcare access and quality. The CDC has stated that the social determinants of health have a far greater impact on one's health than either genetics or medical care. They have further stated that while medical care makes up 20% of one's health outcomes, the social determinants of health make up 80%. And when we look at the statistics pertaining to the social those suffering from obesity has increased by 16%. Now, if you're like me, you're wondering, why is that? Well, that has a lot to do with the number of food deserts that we have in Oklahoma. The Oklahoma Food Bank has stated that 54 out of our 77 counties in Oklahoma contain a food desert. This means that 500 or more people in the area live farther than 1 mile from their nearest food desert. Because of these communities have to resort to Dollar General stores and fast food chains for their meals and for their produce. Because of this, a number of health issues in the area have increased. These communities are suffering. Now, there's progress being made, but not much. But I want to show you what I'm getting at. That if we want to decrease the number of deaths by heart disease and the number of deaths in Oklahoma overall, we need to decrease the number of food deserts in Oklahoma. By decreasing the number of food deserts, we will impact a number of health issues positively and make a change in our communities. They are all connected. And if we want to decrease the number of deaths in Oklahoma, we must start by addressing an unaddressed social determinant of health. Now, what does that look like in our city? In 2021, the Wall Street Journal published an article detailing about the differences in health outcomes between North Tulsa and South Tulsa. Since the Tulsa Race Massacre in 1921, the North Tulsa community has had worse health outcomes than the South Tulsa community. The Tulsa Race Massacre has left the North Tulsa community with less economic stability and less medical infrastructure. And when we look at the statistics, we see this is true. According to the Tulsa County Health Department, the North Tulsa community has a higher rate of heart disease, lung disease, diabetes, and cancer. People who live in North Tulsa have a 13-year shorter life expectancy than in South Tulsa. And North Tulsans struggle to find primary care doctors and doctors overall because there's a lack of medical infrastructure in the area. And lastly, 3/4 of North Tulsans live in a food desert. The Oasis Fresh Market is making strides to fix this. The Oasis Fresh Market, despite only opening a few years ago, has made a big impact in its community. The Oasis Fresh Market exists to eradicate food deserts by providing additional services such as rental assistance, financial literacy, clinical care, and workforce development to its community. The Oasis Fresh Market is an example of a social initiative that exists to pertain to the social determinants of health. Now, there are some medical organizations out there that are also trying to integrate the social determinants of health into their care. The College of Baylor has recently done a study that when they provided enhanced care to poorly controlled asthma, they tested their results to see how patients fared. The director of the study reported that these patients with enhanced care had less emergency department visits, more symptom-free days, better asthma control tests, and better livelihood scores. But these organizations continue to struggle to find funding and support from their communities. Oklahoma specifically has a lack of organizations that integrate the social determinants of health, both social organizations and medical. If we want to create a healthier tomorrow and a healthier America, we have to start integrating the social determinants of health into our healthcare system. The current healthcare system is failing us, and we need to start integrating social care if we want to decrease the number of health inequities and health disparities in America. The social determinants of health should be entwined in everything we do in the healthcare system. It is a necessity, and it is a must. I'm going to leave you with one last thing today, and that's a quote from Martin Luther King. He said, "Of all forms of inequality, injustice